This is Rip. He's about 1 year old, mixed breed. He was presented for castration, but also, if you'll notice, his left eye has an Entropeon that's rolling in. If you can see it, the lower lid wants to roll in. And those little fine hairs are irritating the mucosal lining of the eye. Also watch on the upper lid how the lateral aspect of the lid also wants to roll just a little bit. So what I'm going to do is I'm going to correct that Entropeon and the lower lid and the upper lid, the lateral aspect of it. That's his left eye. On his right eye, notice that everything appears to be somewhat anatomically correct. There is a slight rolling inward of the lower lid, but nothing, the lashes, there are no hairs touching the mucosa or the eyeball. So to keep expense down, since the right eye is not as severe as the left, I'm only going to correct the lid on the left. Okay, let's study this left eye a little closer. Okay. All right. I think the camera's focused. Now release. Definitely an Entropeon of the lower lid. And slight Entropeon of the upper lid, primarily about 1/3 from the lateral commissure. Okay. At least 3/4 of the lower lid is wanting to roll in. Alright, gotta correct that. Okay, as you can see, the eye is no longer an Entropeon. This is the upper lashes right here. When all these sutures come out, it'll be fine. I tend to make my incision on the upper lid closer to the edge than I do the bottom lid. I usually make my incision where the hairline stops. I tend to take out, this is the lower lid right here, I tend to take away just the outer skin edge. Just the outer skin edge. Not any subcutaneous tissue, but the outer skin edge. Just a guesstimate of whatever it will take to roll the lid back off the eye. A lot of times when you correct the lower Entropeon, the upper one will become more dramatic. The incision from the upper one required a lateral incision right in here. And then the parallel incision right through here, taking out about a width of this much right here. And then, of course, suturing everything back together. I tend to avoid any sutures in this area. By the way, there's 4 throws in the suture because the first throw is extremely, you don't want to make it a tight closure. You want it just skin to skin. Then the next layer is a little snug, and then the third layer snug on top of the second throw, and then the final 4th throw is very snug. It makes it look like a big suture, but it's not. Okay, the incision basically went from here all the way over to here. Yes, it looks like a defect there, but it's not. When all this is healed, you will no longer have an upper or lower entropeon of the lid and the lashes irritating the eye and causing it to water constantly and the pet squinting and discomfort. A head shield will remain on for 10 days.